What if you're in a hospital in India or China? And I don't mean to pick on those two countries specifically, but once you get out of the high-income countries to low and middle-income countries, does the pattern look the same, or are there broad differences?
Well, I would say there are a couple of places in which there are substantial differences. Notably, the risk of adverse drug events is a bit lower.
It's lower.
Yeah, and that's in large part because fewer medications are used in developing and transitional countries.
Got it.
Because many of the most dangerous medications are actually quite expensive. And then infections are more common.
So if you think about it from an overall profile of patient safety, it sounds like what you're saying is your risk of having an adverse event, having something bad happen in the hospital, probably no different in a lower middle income country, but maybe a little less likely to have a medication problem, adverse drug event, but maybe a little more likely to have an infection.
Exactly. And the risk of most complications is probably somewhat higher. The chance that it could be prevented is also a bit higher.
Got it.
The other broad category that we don't have on this list is birth-related injuries, and those are extremely important, especially in developing countries. You know, one of the things that happens in developing countries is that birth rates are very high, so it's something that happens a lot, and yet the resources that we have to deal with things are somewhat more limited. And both fetal and maternal mortality rates and injury rates are substantially higher in developing countries.
Got it. So this is not just about the fact that when women come into the hospital or a birthing center that they might have the normal complications of childbirth. But you're saying that in the process of care delivery, there may be new things introduced that can cause problems.
Yeah, that's part of it. I mean, part of it too is that women often come later to birthing centers. So they come, after they're suffering a complication.
I'm going to take a step back and say, here we are. We've identified a set of adverse events, injuries that happen due to medical care. We've talked about it for high-income countries. We've talked about it for low- and middle-income countries. Let's say we put all this together. From a population health point of view, is this a small deal? Is this a big deal?
If you put it all together, it's actually a really big deal. If you look at causes of death, it's a little uncertain what the exact numbers are, but in developed countries, this probably comes in right after cardiac issues and cancer. It's probably the third leading cause of death. So it's really a serious issue.
And there's some work that we've done together, supported by the WHO, that tried to quantify disability-adjusted life years lost, sort of how many years of life are lost. We found that about, 23 million disability-adjusted life years are lost around the globe from just these kinds of events.
Exactly, and there were other things that we couldn't include, and we made very conservative estimates, I would say, throughout as to how big the magnitude of harm was.
Let's take a minute and just kind of identify what were things that you think are clinically important that we weren't able to get to.
Right, so among those were counterfeit drugs, unsafe injections.
Unsafe injections, yep.
And the other big one we already mentioned, which is the birth-related injuries.
Yep. So this is very helpful, and the main reason we couldn't get at this is really data issues. Is that fair?
Exactly. So, for example, for counterfeit drugs, some estimates are that up to half of all the medications in developing countries are not truly what they're supposed to be. Now, the exact proportion is uncertain. The benefit that people would have gotten if they were the real thing is also not clear. But it's pretty clear that it's a big issue.
When we talked about adverse drug events, we were talking about giving legitimate drugs but having problems from that. Here, the issue is even if you give the right treatment, there may be, in some instances, as much as half of the medications may not have the exact substance and dose that it's claimed to have.
Exactly. And around unsafe injections, for example, in some parts of the world, it's routine to give a lot of injections. That's been a long-standing practice, for example, in India. And it was quite common to reuse needles, which obviously carries with it the risk of HIV transmission as well as hepatitis B and C.